Bismillahirrahmanirrahim. Today we will discuss about the sacrum. Now here you can see this bone is the sacrum. It is a large, massive and triangular bone, and it is formed by fusion of 5 sacral vertebrae. Now in bony pelvis, here you can see this one is the bony pelvis. It is present posteriorly, and on each side it articulates with the hip bone, right and left hip bone, and here it makes the right and left sacroiliac joint. Now upper part of the sacrum is massive and it supports the weight of the body and it transmits it on the hip bone, while lower part is free from weight, so it tapers rapidly. Then after that we will discuss about its different bony features. Now this one is the upper end and it is known as base of the sacrum. Now this one is the lower end and it is called apex of the sacrum, and it has 4 surfaces. This one is the pelvic surface or anterior surface. Now this one is the dorsal surface or posterior surface, and there are right and left lateral surfaces. Now on the sacrum there are row of foramina, sacral foramina. These sacral foramina divide the sacrum into median area. This one is the median area, and lateral mass. Now this lateral mass is formed by fusion of transverse process and costal element. Then after that we will see the anatomical position. Now, anatomical position of the sacrum is like this, that its pelvic surface is directed downward and forward, its dorsal surface is backward. This one is the sacral canal. Now upper end of the sacral canal is upright, it is directed upward, and this one is the body of first sacral vertebra and it slopes forward at an angle of 30 degree. Now this was the anatomical position. Then after that we will discuss about its different features one by one. Now this is the base of the sacrum, and here it has body of first sacral vertebra that is highly modified. Now body of first sacral vertebra, it articulates with lumbar vertebra like this, and it makes the lumbosacral joint. Then this is the anterior margin of the S1 vertebra and it is projected forward and it is known as sacral promontory, and it slopes forward at an angle of 30 degree. Then behind the body, this is the vertebral foramina and it is triangular in shape and it leads into sacral canal. Now this one is the sacral canal. Now here you can see these are the pedicle. They are short and they are directed backward and laterally. Now these are the lamina. They are long and obliquely lie, and where they meet together there are the spinous tubercles. Now these are the superior articular processes. They are projected upward, and facets on the superior articular process are directed backward and medially. Now lateral to the body, this one and this one, it is formed by fusion of transverse process and costal element anteriorly. Now this whole part that is sloping like a fan wise from the body, from here to from here, it is known as ella of sacrum. Now this one and this one is the ella of sacrum. Then after that we will discuss about the apex. Now this one is the apex and it is directed downward and it is formed by inferior surface of S5, and it has the facet and it articulates with the coccyx and makes the sacrococcygeal joint. Now this one is the pelvic surface. The pelvic surface is smooth and concave, and it has 4 pelvic sacral foramina. Now these four pelvic sacral foramina on each side divides this surface into this median area and this lateral mass. Now on the median area, here you can see these are the 4 transverse ridges, and these transverse ridges shows the line of fusion of bodies of sacral vertebra, sacral body. Then laterally where this ridge end, there are the pelvic sacral foramina on each side, and this pelvic sacral foramina opens into the sacral canal through the intervertebral foramina. Here you can see the opening of sacral foramina. Then this bony bar between the pelvic sacral foramina is known as costal element, and this costal element laterally it meets with the transverse process, and here it makes the lateral mass of the sacrum. Then after that, posterior surface. Now this one is the posterior surface, and posterior surface is convex, rough and irregular. In midline it has median sacral crest. This one is the median sacral crest which bears 3 to 4 spinous tubercles, which shows the fusion of sacral spines. Now here below the fourth tubercle, here you can see this is inverted U-shaped gap, and it is known as sacral hiatus, and it is formed by failure of fusion of lamina of fifth sacral vertebra posteriorly. Now lateral to the median sacral crest, this area and this area, it is formed by fusion of lamina. Here you can see this one is the lamina, and here there is the fused lamina. Now lateral to the lamina, in line of superior articular process. Now this one is the superior articular process. Here are the four articular tubercles, and again the fifth one will not meet, and here it makes the sacral cornu, and this one is the sacral cornu. Then lateral to the tubercles, there are the dorsal sacral foramina. There are four in number on each side, and these dorsal sacral foramina they open into the sacral canal through intervertebral foramina like this. Then lateral to the dorsal sacral foramina, this line and this line is the lateral sacral crest, which bears the transverse tubercles, and these transverse tubercles shows the fusion of transverse processes. Then after that, this whole surface and this whole surface is the lateral surface. Now lateral surface has the upper end and lower end. In upper end it has the auricular surface, L-shaped auricular surface anteriorly, which articulates with the hip bone and makes the sacroiliac joint, while the posterior surface is pitted. Now in the lower end there is the medial abrupt medial band. This is the abrupt medial band, and it is known as inferior lateral angle of the sacrum. This one and this one is the inferior lateral angle of sacrum. Then after that, this one is the sacral canal, and sacral canal it is triangular in shape, and here it leads into the sacral hiatus. Here inferiorly it leads into the sacral hiatus. Now the contents of sacral canal are important. These are spinal meninges, phylum terminale, subdural and subarachnoid spaces. And through the dorsal sacral foramina there is passage of dorsal rami of upper four sacral nerves, while through pelvic sacral foramina there is passage of ventral rami of upper four sacral nerves, and also there is passage of lateral sacral artery. So it was all about the bony features of sacrum.